So, this topic is about the sleep science and its impact on the injury recovery. So, now we define what is the sleep. Sleep is basically active, induced, and highly organized brain state with different phases. It characterized by first, it reduce the motor activity. Second, it decrease the response to the stimulation. Third, it have a stereotype posture and having a relatively easily reversibility. So we define the sleep is basically a naturally occurring altered state of consciousness characterized by decrease in awareness and responsiveness to stimuli. So why do we sleep? Why do we sleep? It almost all animals require the sleep. Slow sleep deprivation causes the irritability, reduce the cognitive function, general malaise, and the death. Sleep is required, but psychologically function is speculative at best. Natural maturation, facilitation of learning, consolidation of memories, facilitations of the development, importance of the REM sleep, and conservations of the metabolic energy. So, what is the psychology of the sleep? Sleep basically controlled by the reticular activity system and bulbar synchronizing system. Wakefulness occur when the reticular system is activated. So our hypothalamus has control centers for several involuntary activity of the body, one of which concerned with the sleeping and the walking. Injury to the hypothalamus may cause a person to sleep for abnormally long periods. Stages of the sleep. So the first stage is very fast, which we call the theta waves on the EEG. It is the muscles relax. It has been the respirations become even, the pulse rate become decrease. This stage usually lasts only a few moments, minutes, and if awake, the person may say he or she may not sleep. The stage two is burst of the sleep spindles appear on the EEG. It having the rolling eye movement continuous and snoring. Body function continue to slow. The stage 3 and 4, which is the delta sleep seen in the EEG. The muscles are relaxed, but muscle tone is maintained. The respirations are even. Vital sign urine formation and oxygen consumption may muscles decrease. In this stage, snoring, sleepwalking, and bedwetting are most likely to occur. REM and non-REM sleep. REM is basically the rapid eye movement. Rapid eye movement sleep closely resembles wakefulness except for very low muscle tone, indicated by a reduction in amplified amplitude of the EMG. Blood pressure and pulse rate show wide variations and may fluctuate rapidly. Respirations are irregular and oxygen consumptions increases. Vaginal secretions increase in women and excretion may occur in the man. REM and non-REM sleep. REM sleep start about 90 minutes after you fall asleep. Brain becomes active, eye movement rapidly under eyelid. Most dreaming happen in the REM. Importance for the memory, learning and emotional health. Non-REM sleep has three stages. In the non-REM sleep, the first is the light sleep, easily to wake up. The second is the body temperature drop, heart rate slow, brain activity decrease. And the third stage is the deep sleep, also called the slow wave sleep. Most physical recovery, tissue repairs, and immune strengthen happen here. What is sleep science? Sleep science is also called somnology. It's the scientific study of sleep and its impact on the health, brain function, and overall well-being. It explores the sleep stages, which is the REM and the non-REM, sleep cycles and the patterns, biological process during the sleep, like hormones release, memory, consolidations, sleep disorder, which we call the insomnia, sleep apnea, etc. The link between sleep and mental physical health. Impact of sleep on injury recovery. Sleep play a critical role in health and recovery. During sleep, the body focus on healing, repairing tissue, reducing the inflammations, strengthening the immune system, and balancing the pain perception. Without enough rest, recovery slow down, pain worsen, and the risk of complication increase. It have also impact on the injury recovery. For example, tissue repair and regeneration. The body enter into deep sleep, which we call the sleep slow wave deep during the night, and this is the most critical phase for the physical healing. During this stage, the brain signals the release of the growth hormone from the pituitary gland. The growth hormone play a key role in muscles repair, healing the micro tears caused by injury or strain. Tissue regeneration, restoring the damaged skin, ligaments, and tendons. Bone healing, supporting the bone remodeling and fractures become repair. So, without deep sleep, growth hormones levels drop, slowing the healing and both minor and major injuries. Sleep on the injury recovery also reduce the inflammation. Injury often cause the inflammation, which is the part of the body healing process, but can delay recovery if prolonged. So the sleep regulates the pro-inflammatory cytokines, which is the protein that control the immune response. Proper sleep help in to reduce the excessive inflammations that lead to the pain and swelling. Maintain a balanced immune response like chronic sleep deprivation lead to higher level of inflammation, which can worsen the tissue damage and delay the recovery. Pain perception. So sleep help to a lack of the sleep heightens the brain response to pain, increasing the pain sensitivity. You may feel more pain from minor discomforts. Have lower pain tolerance, making rehabilitation harder. In contrast, good sleep help in modulate pain pathway in the brain, improve the pain coping ability, and sleep-primal individuals may also help us more painkillers, increasing the side effects and slowing the health healing indirectly. Fourth one is the immune function. The immune system is vital for clearing the damaged cell and preventing the infection in wounds or surgical sites. So sleep boosts production of the T cell, which is the fight infections, efficiency of macrophages, which remove the debris and the dead cells. Poor sleep weaken the immune, increasing the infection risk, inflammation, and healing time. Fifth one is the mental and emotional recovery. So injuries often being stress, anxiety, and depression, especially for athletes or active individuals. So sleep supports the emotional regulation by REM sleep, which is the dream phase. Reduction of the stress hormones like the cortisol. Lack of the sleep increase irritability, negative moods, and difficulty staying motivated during the recovery. So, as a summary, we have seen how quality sleep is not just stress, it is an active recovery. From tissue repair to emotional strength, sleep play a powerful role in every stage of healing. So, as a focus on treatment, medication, or physical therapy, let's not overlook sleep as one of the most natural and effective tools for the recovery. Prioritize sleep is because healing happens when the body truly rests. So this is all about the sleep and their effect on our daily life activities. Thank you so much.